are you new? Is this the first time you've
Oh, I
been?
was doing years ago, I'm old now.
Point taken, okay.
Okay.
All right, so I'm going to do a really brief introduction since most of you guys know me. My name's Dr. Deb, and I've got all these alphabet soup behind my name. I added this little symbol up here to make sure you guys know that it's clear that I am a health education specialist, and that's the capacity that I'm here talking to, okay? All right, so these are some organizations I'm a member of. The reason I mention this is because this is sort of an unusual one for me to be a member of as a naturopathic doctor. I'm a member of a dental organization. So this is the International Academy of Oral Medicine and Toxicology. It's the IAOMT. I'm going to mention it a lot today, and so that's why I brought that one up. And some of these other ones, these are all naturopathic physician organizations, and then this is a public health education organization that went along with my master's in public health. Okay, so this is a little bit about what naturopathic medicine is and what's in our scope of practice for states that we're licensed in, but I'm not going to go through that. You guys can read it on your own. Just as to be very, very clear, 26 states and jurisdictions allow naturopathic doctors to be licensed. Tennessee is not one of them. So I am here as a health education specialist and giving you general information, and if you think anything in this lecture applies to you or could apply to you, make sure you go over it with your primary care physician. Okay, that's my disclaimer, I just told you. All right, and we've talked a little bit about the therapeutic order in the past, but basically this gives you a feel for how I approached health. And basically we start at the bottom and we try to remove obstacles to cure and build the foundations for health, and then try to encourage the body to heal on its own. And so that's the quick version of how I approach medicine. Okay, so now here we are. So today we're going to be talking about oral health and its association with heart health. And this is a big one for me because heart disease runs in my family, right? So I do almost everything in this lecture. I do my own healthy heart protocol because I will be 50 next month and I'll be a member of the Oak Ridge Senior Center. I'm so excited. So anyway, so I started around 45 years old trying to do heart healthy things, and then I've increased, what I've been doing to try to keep my heart healthy preventatively. But this lecture is not about heart disease in general, although there's going to be some general statements, but this one's specifically about how our mouth and our oral health contributes to our heart, and you're going to hopefully learn some things and be surprised. So this is a slide I've shown in other lectures, but I'm going to show it again real quick. Research indicates that gum disease can double your risk of heart disease and also increase your risk of stroke. And that seems odd, people don't understand, how does gum disease, that means bleeding gums, how will that contribute to heart disease? Well, we're going to do a deep dive and explain why that is. Okay, so today, this is sort of like the outline for the whole lecture today. And these are the different aspects of oral health that we're going to cover and how each of these contributes to our heart, which is could be surprising in some ways. So let's see here. So these are pictures of all. We have gum disease, root canals, our oral microbiome, we have mercury fillings, we have root canals, and even fluoride, fluorosis type issues. So that's toxin exposure. And there's more, there's even jaw issues as well. So this book I always bring up, it's right here. I highly recommend it for anyone who has root canals or is thinking about having a root canal or has been told they need to have a root canal. I highly recommend this book. Dr. Levy wrote it, Thomas Levy. He's one of my heroes. And basically, the hidden epidemic that he's talking about in this book is hidden dental abscesses, and we're going to talk about that in a lot of depth. But the main thing is, in this book, he lays out the case for oral infections being responsible for most heart attacks and breast cancers. And that's pretty significant, right? And what he talks about in this book as well is that when you have a lot of hidden dental abscesses, have no symptoms at all. There's no pain, there's no pus, there's nothing. You have no idea you have the hidden abscess. But you'll see in a few slides, that is a constant drip of pathogens into your arteries, which leads straight to your heart. So we're going to talk about that. Okay, so hidden dental abscesses. This is really hard to see, but let's see. So it looks good on the wall, but if you notice, it doesn't look good here. But do you see this gray pocket right here? okay? And there's one right here too. That's the abscess. So here's another one that's a little darker, but usually they're very light gray, and they're very difficult to see on normal dental x-rays. You typically have to request a 3D cone beam scan from your doctor, and then you can see it. Then you can see the actual abscess easier. So if you have dental issues, I highly recommend you find a dentist that has a 3D cone beam scanner, and you have one done and you explain to them why. And they're going to tell you, well, if they're not a biological dentist, if they haven't been certified by the IAOMT, they will say, no, you don't have a hidden abscess. I can tell you if you have a hidden abscess. If I push on your teeth and there's no pain, and I look, yeah, that you don't have an abscess. That's what they'll tell you. No worries, you're over worrying, and I'm telling you they're wrong. They're wrong, and you can get a lot of published studies to prove this. Going onto the IAOMT website, they have lots of videos, but I'm going to show you one in particular that, if this is of interest to you, please watch the entire video. You will be convinced by some experts. But the point is, you need to find out if you have a hidden dental abscess, because the pathogens will drip into your artery. So if you look here, you see these yellow, red, and blue. That's artery, veins, and nerves. And each tooth, every single tooth in your jaw, actually, in both the mandible and the maxilla, connect to arteries, and those arteries go into the inferior alveolar artery, then that goes straight into the external carotid and then the common carotid, and then straight into your heart, which is why the pathogens that are in your mouth and dripping from a root canal, from the root, the abscess, will go straight to your heart and cause inflammation of your coronary arteries, which then lead to plaque buildup. And so we'll talk about that some more here. So this is a picture that I like to show, and let's see, where's my pointer here. But what you're looking at here is this artery right here. This is a little light colored one. I tried to highlight it right there. Okay, it goes all the way up to here. Okay, that's the inferior alveolar artery, and it connects to this right here, which is the external carotid artery, and then it goes straight to your heart. So, and a lot of people have carotid artery stenosis, like it's, and some, a lot of plaque buildup in their carotid artery. A lot of times that's because they have a hidden dental abscess that they are unaware of. So there are definitely certain times that, if you know in your family you have a lot of carotid artery plaque and things like that happening in your family, then I would immediately, once again, recommend you get a 3D cone beam scan from your dentist to look for hidden dental abscesses. And I would actually encourage you to find an IAOMT certified biological dentist by going to their website, and then you can find ones that are around here. And then they will be familiar with what I'm talking about, because they are the ones who taught me all of this. I go to their conferences to learn about all of this. Okay, so here's a picture of how the pulp, this is called the pulp of the tooth, and we're going to do a little anatomy lecture here on the tooth, but all the living part of the tooth is in the pulp. And it has veins, arteries, nerves, and they connect to that inferior alveolar artery, at least if it's on the mandible. And then, so this just shows you every single tooth has a blood supply and the nerves. And that's why we have toothaches, they hurt so much because there's nerves. And I'm going to go into that a little bit more. But some things I want to bring notice to is this is the living part of the tooth, which is the pulp. And this part right here is called the dentin, okay? This little starburst pattern, okay? And then we have the enamel, but look at this part. See how the enamel sort of dovetails right here with this stuff right here? That's called the cementum, and this is the periodontal ligament. And then this is regular bone right here, okay? All of this is regular bone. And the abscesses usually will happen here, and I'll explain why. But the dentin is made from inorganic material. It's not living. Think of it sort of like your fingernail. Right? It's a non-living inorganic material, so it doesn't have a huge ability to regenerate, but it's tubes. So the dentin is a bunch of tubes, and this is going to make a lot of sense here in a second. I wanted to bring up some points here. Teeth are not bone, okay? They're not bone. Teeth, consider your teeth like your fingers or something. They're individual organs. Every single tooth is an individual organ. And it's very unique compared to bone. And bone gets its blood vessels from the periosteum right here, and bone marrow actually makes our blood. That's where we get our blood. Our blood is made in the bone marrow, okay? And it's completely different structure of how it gets blood and all that kind of thing, and it's considered living, okay? Whereas a tooth, the only part of the tooth that's living is the pulp. And the tooth is the only part of our body that is inside the body and outside of the body simultaneously, okay? Because the cementum, so if I go back to the slide here, this cementum, this little thin layer, anchors, along with the periodontal ligament, anchors this part of the tooth right into the bone. It's anchored, so that's inside the body, but then this whole part right here, the crown, is exposed and outside of the body. So we literally have an organ that's inside of the body and outside of the body at the same time. This should be informative to you because you can consider it, if it gets infected, it's a window, it's a direct chute into the inside of your body, right? It's an open doorway to the inside of your body. And we have a ton of bacteria in our mouth, a ton. And it's worth making sure we are healthy so it doesn't affect our heart. I don't care if your teeth are pretty, I really don't. I don't care, I'm not a dentist, I don't care about that. I do care about your heart. Heart disease is the #1 killer. It's extremely important we take care of our heart. Okay, so let's keep going. So this is a technical slide, and these are all my notes from when I took a long postgraduate course to understand oral hygiene and oral health. I didn't have dental classes as part of my medical education, so I had to go seek them out afterwards. But an odontoblast, that's the name of a cell. So here are all the odontoblasts, these little round, cute little things here. And those are cells that literally are responsible for creating the dentin tubule. So this is the dentin tubule, and so this is the outside of the tooth. Here's the enamel, right? Down here's the cementum, you can't see it, but all these holes are right here. Now these are exposed dentin. So when we have a receding gum line, when our gums recede, what happens is the gums pull away from the enamel, and now the cementum of the tooth is exposed, and the cementum does not have a cap over the dentin tubules, which means now you have literally a direct shot from the bacteria in your mouth straight through the dentin right into the pulp, right? The only thing keeping the bacteria in your mouth from not migrating is this enamel cap. You see the enamel cap right here? But once you pass that and you're in the cementum, all these dentin are exposed. And a lot of us as we get older are familiar with this because when your teeth become sensitive to heat and sensitive to cold and you get very sensitive teeth, that sensitivity is not the enamel part, it's the cementum being exposed and all these dentin tubules being exposed, right? So a lot of you, so here's another picture of it. Here's the tooth, here's the receding gum lines, here's the dentin tubules being exposed, which makes a very sensitive tooth. Okay, so how many of you have heard of this toothpaste, Sensodyne? I definitely have, absolutely. And so how does it work? Like what is this whole, what does it do to make your teeth not sensitive? Well, what it's doing is filling up those dentin tubules. It's literally stuffing them full of stuff. So that way, it's putting a cap on it, like instead of the enamel, right? But it's very temporary, and they say only 24 hours, right, or something like that. It will help calm the nerves for 24-hour sensitivity protection. But what it's doing is it's capping off these exposed dentin tubules, which is great because now bacteria can't get in there too, so that's a great thing. But it's very temporary. It's just a temporary solution to the problem. The real solution to the problem is to regenerate your gums. You want to regenerate your gums to recap all those dentin tubules, and so I can show you how to do that. All right, but now it should make sense, a lot of this should be coming together if you understand the anatomy of the tooth a little bit more. Okay, so I'm going to show you this research article about what you're seeing here, and all this is coming together. I'm giving you all the information, so when I make a claim here in a second, it's going to make a lot of sense. But basically, what you're seeing here is little bacteria in the dentin tubules, right? Bacteria. So what they're proving is bacteria can go from the inside of the pulp of the tooth out through the dentin tubules, and it can go from the outside in, right? Because it's a tube. And bacteria is going to migrate wherever, right? Okay, so this particular one showed that in root canal teeth, that they treat a root canal tooth. So after they drill it out, and I'm going to show you some pictures, then they do all kinds of stuff that's supposed to kill everything that's in the tooth. But what they're finding is, in this study, you can read it, they took the tooth and biopsied it, cut it in half, and then looked to see if there was any bacteria in the tubes, and there was. So then they retreated the tooth. So then they treated tooths twice, and they still found it. So that's what this study is showing, is that they still found microorganisms even in retreated teeth, right? So this is interesting, because what it means is the tubes, the dentin tubules are so small, you pretty much cannot kill all the bacteria that's in the dentin tubules, right? Okay, so here's some more pictures of it. Scanning electron microscope, images of the retreated group. And it can be traced, the bacteria can be traced up to 74 micromillimeters, whatever, and it penetrates. So they're just showing you bacteria is still found, okay, even when the tooth is retreated. Okay, so a lot of times you'll hear people say, well, I had a root canal, but it was a failed root canal, and I gotta go do something else, right? Well, I'm gonna say that in my opinion, as well as the IAOMT's opinion, all root canals are failures, every single one. Now that's a very controversial statement, especially for endodontists, and they'll tell you that's not true. I encourage you to do your own homework, and I'm gonna give you the resources in this presentation to go do your own homework and make your own decision. But I want you to know it's a controversial statement, but I believe it completely because of the experts at the IAOMT who took a sample size. It was over several hundred root canal teeth, and they biopsied every single one of them, and they were 100% positive for bacteria, every single tooth. So even ones that hurt, ones that didn't hurt, it didn't matter. Do you have a question?
I was going to say, so the ones, I guess, that they refer to as the success, they're mainly destroying the nerve interaction, so it doesn't hurt anymore.
I will leave that to the endodontist to say why it doesn't hurt anymore, right? I have not looked into the pain aspect. I will say that it doesn't matter if it was a failed root canal or what they call failed, or if it was a successful root canal, or one that hurt, or one that didn't hurt, or one that had a hidden abscess, or one that didn't have a hidden abscess. It was irrelevant. If it was a root canal tooth, they found bacteria in the dentin tubules, okay? Now, this is important because when the tooth is alive and the pulp is living, the blood vessels that go up into the pulp bring hemoglobin, right? And hemoglobin carries oxygen, and it helps create, at least in the pulp of the tooth, an aerobic environment, right? Not an anaerobic environment, because the hemoglobin brings oxygen to keep the pulp alive. And that oxygen does get into the dentin tubules. And they prove this because what happens is once you do a root canal, you kill the pulp, you fill it. Now you've trapped the bacteria in the dentin tubules, and it's an anaerobic environment. And so it causes a cesspool of bacteria proliferation in an anaerobic way, which then gets into your gum line and can cause a predisposition or a more of an inclination to have receding gums, gingivitis, and periodontal disease, right? So even if the root canal's fine, even if you don't have a hidden abscess at the root, you still are trapping bacteria in the dentin tubules, which is causing inflammation to the gums, and the gums do have a blood supply, and they also lead into the inferior alveolar artery, and it's still a problem. Bleeding gums is a huge problem. So, okay, so let's keep going. So this is how they do a root canal. This is what they teach you. They go in, they drill all the way down to the root, and then they fill it, right? And they drill, and then they clean it really well, and then they inject it and rinse it out with all kinds of antibiotic solutions that are supposed to kill all the bacteria. And so we've just learned from the study that I showed, and there's many, many more studies that show that the bacteria is still in the dentin. So this is all the dentin, and the bacteria will still be trapped here. But it gets more complicated than that. And so this is interesting. So here's a picture. The theoretical root canal looks like that, and that's what we're all used to seeing. But that's not what our roots and our teeth look like, okay? The roots in our teeth look like all kinds of stuff, right? They're very varied. So there's a lot of variability in what our roots look like. Well, I don't know, but, is the dentist gonna drill out that one too, and that one, and that one, and this little thing, and this little thing, I don't know, so then it gets more complicated than that. Here's some more pictures of what normal roots and teeth look like. So, that'd be really hard. So maybe they could just drill the whole thing out completely, you know, I don't know. This is a conversation for an endodontist. But the point is, it's complicated. You have these little leader roots, right? So it's the probability that when they do the root canal, that they're getting every single little root is unlikely, okay? So here's other pictures of how they classify roots. So they might be getting most of it, you know, but it's very unlikely that they're gonna get all of it, right, of the root, okay? Because of the variability of the root. So even if they got the entire root, we know the bacteria is in the dentin, but we also probably have some trapped bacteria in little root leaders that haven't been drilled out, right? So it's something to consider. Okay, so I'm gonna hopefully end the root canal discussion here soon, but if this is something you're interested in really knowing what the research says about it, this is an hour-long talk called The Roots of Toxicity by the IAOMT and some experts, endodontists, that talk about all the research that's out there. It's absolutely fascinating and horrifying to listen to this lecture, but it's by an expert. And she's amazing. And this was a screen capture I took yesterday to show it, but she explains why root canal treatments fail. She explains in detail of why, okay? A lot more than I can do because I only have a cursory knowledge of dental things, but she's the one who, and the IOMT in general, is the one who convinced me that root canals are very dangerous. It's like having a dead finger on your hand and you're trying to, you know, keep the infection at bay so it doesn't infect all your other fingers. Well, imagine all your teeth are like a bunch of fingers, right? And you got a dead one right here, and the gangrene is like moving to the other fingers, right? You don't want to do that. So the IAOMT recommends all root canal teeth be removed because it's like having a dead finger in your mouth, you know, like you don't want that. Okay, so, and it contributes to heart disease a lot. Okay, so we're going to keep going. So now we're going to talk about gums. Let's talk about gums. Let's pretend that the root canal tooth was a perfect root canal, which is impossible, but let's pretend it was a perfect root canal. Well, the thing is, that means the root itself was completely sterilized and filled. Well, we know, even if every single little tiny aspect of that root was filled, we know that the bacteria is still in the dentin, right? Okay, well, then it's going to try to make its way out, okay? And the way it makes its way out is through your receding gum line, and it will inflame. That bacteria will be dripping into your gums slowly, causing gum inflammation and making your gums red and inflamed, right? So even if the root canal is perfect, you might have red gums, and then it will spread to other teeth because it's a pathogen that just, you know, starts proliferating in your mouth, okay? So there's a way that dentists check to see if you have how healthy your gums are. And they use this little tool called a pocket depth tool, and it has these little marks on it that each of these marks right here, this little black one, and then the silver and the black, each of those are 3 millimeters, okay? And so you put it in the gum, and if you're less than 3 millimeters or less, you have healthy gums for a pocket, okay? Now, what happens is when you stick, there we go, when you put the pocket tool here and it's within the silver, then you're starting 6 millimeter depth of, now you have gingivitis, right? And then over 6 is like periodontal disease, okay? So that's how you can check it, and it's very easy to check. You can buy these on Amazon for practically nothing, so you can buy your own probe tool. It's worth checking your teeth. I have one, so, gingivitis and gum disease runs in my genetics, because I do genetic analysis, a nutrigenomic analysis, and it looked from my genetic profile. I have a twin sister, and she had to have antibiotic shots in her gums from gingivitis and periodontal, receding gums, and I gave her the protocol that I'm going to be reviewing here soon, and her gums are completely regenerated now. So it's worth knowing you can regenerate your gums fairly easily. It just takes consistency. Okay, so this is a study, and this is, to me, a pretty extreme picture. You don't have to look like that to have periodontal disease. You can just have red inflamed gums, okay? But that's the picture they used for this study, which was they showed that periodontal disease is associated with atherosclerosis, which is hardening and narrowing of the arteries, right? So, and it's interesting because, basically, it's saying that when your gums bleed and you have gingivitis, periodontal disease, it causes an inflammation of all your arteries, And that inflammation in those arteries, if you've been medics before, makes those arteries sticky. And if those arteries are sticky from an then the calcium will stick to the arterial walls and you'll slowly have hardening of the artery. So you don't want the inflammation that's results from your mouth having bleeding gums, okay? And so this is saying peripheral artery disease goes up by 60%. So if you have periodontal disease, your peripheral artery disease goes up by 60%, stroke goes up by 24%, this is a myocardial infarction, goes up by 13%, CAD goes up by 18%, risk of death from cardiovascular diseases goes up by 47%. So basically this study proved that your risk of everything heart disease related, it goes way up if you have gum issues. And that's not even root canals. I'm not talking about root canals now. I'm just talking about how healthy your gums are, okay? So it's worth keeping your gums healthy. This is an interesting, so let's talk about plaque and tartar. So tartar, this is tartar right here, and it's just a buildup of calcium, calculus, that's what calcium is, and it's usually a result of excess calcium in the saliva. Now this is interesting because calcium is Ca+2, so it's a very sticky element. It's not happy floating around by itself. It wants to attach to something, like it really wants to attach to something. And usually it attaches to things that are inflamed, like your arterial walls, right? So you don't want inflammation. But it'll also, if you have an unhealthy microbiome in your mouth, which we're going to talk about, it will form a biofilm. The bacterial profile of the biome in your mouth creates a unique biofilm over your teeth, which makes it conducive for calcium to stick onto your teeth, okay? But when I see this, the first thing I think of is, I want to know how much calcium is on your arterial walls. Because if it's sticking to your teeth, there's a high likelihood it's sticking to your artery walls as well, right? Which I would then want you to change your oral microbiome, go to the dentist, get the calculus removed, first of all, and then work on changing your oral microbiome to disrupt the biofilm so the calcium does not want to stick to it. And then that would be for your mouth, which is great, but then I also want you to do that for your arteries inside your body too, and you do that with vitamin K2. Which is in cod liver oil, grass-fed butter, and things like that. And so, so this to me does not worry me because I don't care, I'm not a dentist. What does worry me is I think, oh my gosh, what is your coronary artery calcium score? Right? Okay, so let's keep going. Oops, I don't need that there, do I? How do I make that go away? I don't know. It doesn't look like it's on my computer.
Probably get closed.
I can't see it on
Oh,
the
you can't
computer.
do it.
So I have to do it through here somehow. Do you understand what I'm saying?
Yeah, there it
Yeah,
is.
it's gone.
Thank
Gone
goodness.
now.
Phew.
Good job.
All right, so I mentioned vitamin K2. Vitamin K2 is a fat-soluble vitamin along with vitamins A and D3. And K2 is awesome for heart disease because it has a preference to attaching to calcium. It likes to attach to calcium, or maybe I should say calcium likes it, okay? So calcium wants to stick to something, right? And you don't want it to choose your arterial walls of your coronary arteries. You would rather it choose something else to stick to, and that would be K2. So if K2 is in your bloodstream, it's gonna say, oh look, there's calcium, and it'll take the hand of the calcium, and it will escort it to your bones, it will escort it to all of the things that in your body that need calcium, okay? Rather than the things that it shouldn't be stuck to, okay? So K2 is something I recommend. Now a lot of us are taking vitamin D3 because, you know, a lot of doctors now will just put that in your blood biomarkers, your annual or whatever, and you'll say, oh, my D3 is low, it's less than 30 or something, and so the doctor will say, oh yeah, take 2,000 IUs of vitamin D3 or 5,000 IUs of vitamin D3. And I would not disagree with that, except to say that if you do that by itself, if you take vitamin D3 by itself, okay, without balancing it with vitamin A and vitamin K2, you are increasing your risk of a cardiovascular event. And the reason why is D3 is extremely effective at mobilizing and making available the calcium from your food. That's what D3 does. It makes calcium available. So great, you're eating food. We are all in this room, no doubt, eating plenty of calcium in our food, but now we're gonna get that calcium to be bioavailable, and it's gonna be floating through our bloodstream. I don't want calcium floating through your bloodstream. I want it in your bones, okay? Because if it's floating through your bloodstream, it has more of a chance to stick to your arterial walls, right? So how do you get the bioavailable calcium to get into your blood and then immediately be taken to where it needs to go? You do that with vitamin K2, okay? So K2 is the chaperone for the calcium, and you should take them together. For most people, generally speaking, my recommendation is if you take 1,000 IUs of D3, you take at least 100 mcgs of vitamin K2. So it's 1,000 to 100, right? And most of the time you can buy supplements like this, 80K, and they have the right ratios in there, right? For people who have heart disease and have had a coronary artery calcium score and they know their calcium is high, or you can see your calcium in your blood from your biomarkers is high, I would double the vitamin D3. Not D3, sorry, K2. So it would be 1,000 IUs of D3 to 200 mcgs of K2, because that K2 is going to slowly chelate, that means bind and pull out the calcium from your arterial walls. It's going to prevent your risk of kidney stones. It's going to prevent anywhere that calcium shouldn't be. It's going to pull it out and help you put it where it's supposed to be. So highly recommend this. It will also help you not have as much calculus on your teeth, right? Because your blood, hopefully your saliva level will go down a little bit, and it'll help put the calcium where it's supposed to be. Oh, hold on, see, I have all kinds of weird, there we go. Okay, so now we're going to talk about toxins that we're exposed to from our mouth health. And so, how many of you saw this video that I showed last time? Not very many. I might show it here at the end. I'll see how much time I've got. But this right here is a person holding with their 2 fingers, right, a tooth, okay? And this is a tooth that has a regular mercury amalgam filling, and they took it out of the person's mouth, and they put it behind a green screen that is very sensitive to mercury, so you can see the mercury, right? And then they just took a toothbrush and they brushed it like you would brush your teeth, and then they just held it up. And if you see this trail right here, it's smoking. It looks like the tooth is smoking. Every single time you brush your teeth, you are releasing mercury vapor into your mouth, and you're inhaling it and everything, and it gets into your brain, and it is mercury poisoning. You are poisoning yourself every single time. So the IAOMT highly recommends that you find a biological dentist who is trained in the proper removal of mercury amalgams, so that way you can get these out safely. A lot of dentists will say, I can do this safely, but if they haven't been trained by the IAOMT, then I don't recommend them, because there's a lot of procedures that they have proved in the training procedure they give to the dentists that help. Even you have to have active ventilation pulling vapors, and if they don't have that, then it's not a good place to get your mercury fillings removed. Because what happens is the poisons will lodge into your adipose tissue, and the fatty tissue that's closest to your mouth is your brain. And so you don't want the mercury in your brain causing cognitive decline and those kinds of things. It's just too risky. So either don't get them removed or get them removed by a biological dentist. And okay, so that's that. Younger people can probably get away with it a little bit more, but those of us who are members of the Oak Ridge Senior Center probably need to have it done more carefully. Okay, this is a whole study. There's tons of these studies, and of course my finger's not working. All right, well, I'm just going to point with my finger. There it goes.
There you go.
And it's still hard to see here, but it induces mitochondrial dysfunction. So mercury and cardiovascular disease, right? The role of mercury in cardiovascular disease. It depletes glutathione, which I was talking with one of the audience here before, and it increases lipid peroxidation. So lipid peroxidation, that's what creates the plaque that wants to rupture and cause strokes and a cardiovascular event, okay? Is the lipids having this peroxidation process. So you definitely do not want lipid peroxidation. That leads to a heart attack. Okay, so then they talk about all kinds of overall vascular events, including, just everything. There's sudden cardiac death, and just all these things. Mercury diminishes the protective effect of fish oil, so you're taking all these great fish oil supplements and cod liver oil, you're taking all these great things, but if you know, at the very beginning, I talked about the naturopathic therapeutic order, and I said the bottom is remove obstacles to cure. So I'm gonna repeat, if you can be doing everything right, but if you haven't removed the obstacle cure, which in this case is mercury in your mouth, then it won't matter what you're doing right. You're just gonna be working against yourself, right? So I highly recommend you get the mercury fillings removed, and that's that. You can read about it. Okay, so I've mentioned them a ton today, and I'm going to mention them again right now. The International Academy of Oral Medicine Toxicology is worth taking a look at their website. They have all kinds of what they call position papers, meaning their position on mercury fillings, their position on fluoride, their position on root canals, right? And they have whole papers they write with all of their references, tons and tons and tons of references. They also have a whole YouTube channel with video links with experts talking about all of this, like literally endodontists talking to each other about root canals and fluoride and mercury, and if you're interested in really good experts going into depth on this, this is what I recommend. So this particular paper, hold on, let me read it, okay, is about fluoride. So I really love this paper. This is a PDF file, so if you click right here, this is their fluoride position paper, but this is the slideshow summary of the paper, and it's actually fantastic. It's a fantastic, and it's a lot easier than reading a technical paper. You can just go through the slides and see what their position on fluoride is. But basically, their position is fluoride is toxic. And even topically applied fluoride is toxic, and they explain why. They have all the papers. So since we're running out of time, and I want to get to the meat of this lecture, which is what to do, I will leave this rabbit hole for you to go down and make your own decision. But please look at this paper if you are curious about fluoride. Okay, so this is yet more papers just to show you that periodontal disease, that would be gum health, is related to hypercholesterolemia, so if you're having problems managing your lipids, and then also C-reactive protein, which is inflammation. That's a marker for systemic inflammation in your body. It's associated with higher levels of inflammation and you know, myocardial infarction and more. Here's acute association between gum disease and MI, but we already saw that from other papers. This is just to prove that there is a lot of papers out there that talk about gum disease. Okay, so we're going to talk about periodontal disease and MIs a little bit, but I already talked about it a lot. So the main thing is this gap right here, so that little tool that can go into that pocket, because this yellow part is the cementum, right? Or it's really the crowns, I guess wherever the crown starts, you can't really tell here, but you don't want those dentin tubules exposed. That's what you don't want, okay? And, okay, so here's just another slide saying the same thing, that the bacteria in your mouth, right, here's the exposed dentin. They call it a biofilm bacterial plaque, will cause this gum disease, and then the bacteria comes out of the dentin tubules, gets into the blood vessels of the gum, and then the bacteria goes through those blood vessels and causes all kinds of problems, right? You can start having joint issues where your hands and osteoarthritis, you know, rheumatoid arthritis, you can even have a flare, all because of the health of your gums. So, okay, so we have a whole microbiome in our mouth. Like, we have microbiomes everywhere. We have microbiomes on our skin and our gut. A lot of us have heard of our gut microbiome, but we really have microbiomes everywhere. In our ears, right? You know, our genital region has its own microbiome. You can actually look at and see what kind of bacteria are normal for all these different areas of your body. And it's interesting because here, so this picture is just a generic little colorful picture, but here they actually looked and they found what bacteria are typical in the different areas of just the mouth. So these are all bacteria, all these are different kinds of bacteria that have been profiled for different parts of your mouth. And so that just, you know, is a little more detailed description. And this is a fascinating article if you're interested in microbiomes at all. But basically, originally it was thought that our cells were outnumbered 10 to 1, meaning how many human cells do you have compared to cells that aren't human in your body, right? And they thought it was 10 to 1, but they've redone that, and now it's more like 43%. So the current estimate right here is that you're about 43% human, right? The rest of the cells in your body are some kind of bacteria that's either commensurate bacteria, symbiotic bacteria, or an opportunistic bacteria, which is sort of the same thing. That's why I don't like saying good bacteria and I don't like saying bad bacteria, because a good bacteria can become bad if there's too much of it. So I just like to say there's healthy, you want a healthy, diverse microbiome of certain bacteria in different areas, right? And you want to keep a healthy microbiome, and that means something different for different areas of your body. Our mouth is specific for certain kinds of, here, this is, I like this statement here too. We don't have just one genome. The genes of our microbiome present essentially a second genome which augment the activity of our own. So we have two microbiomes. We've got a, which is very interesting. And so we're going to go into it. Okay, so oral bacteria is found in arterial plaque. And I've mentioned this at lectures before. Basically, the bacteria that has been DNA sequenced in your mouth has been found when they sequenced the arterial plaque in your carotid artery. So the same bacteria that's in your mouth is alive and living in the plaque in your carotid artery. So that's should be proof positive that somehow that bacteria in your mouth is getting into the blood vessels, and there's only a couple ways to do it. It's through the blood vessels in your gums or through the pulp, the root of the tooth. And so our finding is important because it has proved that there are live periodontal bacteria in human atherosclerotic tissue. So it creates plaque in your arteries, okay? All right, so here they talk about an association between oral pathology, that would be all the stuff we've talked about, and carotid stenosis and oral bacterial DNA in the cerebral thrombi. That means, in the stuff that's causing a stroke in your brain, right? That's oral bacterial. Okay, so what can we do about this? So here's some of the books that I dove into to try to figure out how to heal our microbiome. What can you do? One of the best ways to heal the oral microbiome, actually the best way by far, is to change what you eat completely. But the thing is, we're all unlikely to go out and 100% completely change what we eat. So we have to find other ways to support our health while still living the lives that we all live. And so we're going to talk about oil pulling here in a second and some other things. And see, here's another book that's just similar to the Hidden Epidemic by Tom Levy, Dr. Tom Levy. But here's another one talking about the same thing. There's more than one book talking about this hidden epidemic, right? And then the dental diet, I talked about that's the best way to change your microbiome in your mouth is to change what you eat, which I recommend, but there are some other things as well. Okay, so these are the 3 books I have here. If anybody wants to look at them, they're fantastic. Actually, I didn't bring the middle one, but I brought another one. Okay, so.
Are you familiar with the dental diet?
Excuse me?
Are you familiar with the dental diet book?
Yeah, right here. Yeah, I have it. These are books I own.
Oh, okay.
I'm a bookaholic. I read everything, right? I don't believe anybody. I have to go do my own homework, So I hear something, I gotta go read it. And then reading the book's usually not enough either. I usually go look up all the references. So I have thousands of medical studies because I'll read the studies that they, talk about. But yeah, that's a great one. And basically your mouth is your gateway to your whole body's health. And changing what you eat is going to be awesome for your health in general, but it also will change your microbiome. But that's hard to do completely. It just is. And so there are other things you can do to change your microbiome in a positive direction, so we're going to talk about that. Okay, this slide and the next slide, I would say, are the most important slides of the entire lecture. And we're going to go into it in a little bit of depth, but I only got a little bit of time left. This is my summary of an oral hygiene protocol. Okay, and I say summary because I have a protocol that I put together to regenerate your gums, and it's over 8 pages long, and it is for purchase for anybody who wants it. So I put it together for my clients who want it, and I only charge them $5, and then they can have this 8-page document that tells you exactly how I recommend you do this. Or you can go look into this and do your own adaptation of this. This is enough to get anybody started right here, this one slide, okay? But basically, and I'm going to go through this in a second, vitamin C has been associated, we're going to talk about scurvy in a second, but all vasculitis, that means inflammation of blood vessels, including bleeding gums, is related to local vitamin C deficiency. So that doesn't mean you're vitamin D deficient in your whole body, I can't claim that, but if your gums are bleeding, they need more vitamin C, okay? So you can heal and promote healing by taking vitamin C. And I have on here my recommendation of plant-based vitamin C, and the reason why is because I have found clinically people respond way better to plant-based vitamin C. So this is just a clinical observation from my own practice. you can do what you want. If you get online, you're gonna see everything you read. It says that ascorbic acid, synthetic ascorbic acid, is identical, and chemically that is a true statement. But I found clinically a huge difference in how people respond. I've had people's psoriasis and their idiopathic, that means we don't know why, skin rashes clear up with plant-based vitamin C, but not with synthetic ascorbic acid. So now I only recommend plant-based vitamin C. I have 2 of them right here that I typically recommend people. These are inexpensive ones that I've had really good luck with. They're in this presentation, so if you put your email down here on this paper, you'll get a copy of this presentation. So there's like 3 or 4 vitamin C's that are 100% plant-based that I like. So that's the number 1 thing I'm going to recommend for your gums and your mouth health is vitamin C. The number 1. Okay? And your intestinal tract cannot absorb more than 500 at a time, but most of us older people can't even absorb that much. So I recommend taking it in 4 divided doses of 250 milligrams at a time, which is a pain in the tail, because that means you got to put your vitamin C in your pocket, and you got to remember, oh, I got to take another one, oh, I got to take another one, oh, it's time for another vitamin C, right? But like that's the best way if you're having gum issues to heal your gums, and also heal your arterial walls, so that way they won't be as sticky and prone for calcium to accrue, to stick to them, right? So it's very good for your blood vessels. It's all vasculitis, so all inflammation of arteries, right? Okay, next thing I recommend you do is oil pulling. How many of you heard of oil pulling? A couple people, okay, great. So you can get a little tub of coconut oil from anywhere, right? And I have one I keep in my bathroom. This one isn't the one, I just grabbed what I had. And then I even put some clove essential oil in it, but just a little, because clove is very, very strong, very strong. I put some peppermint in there and some other herbs that have been shown to help with the oral microbiome, and I'll mix it in with my coconut oil. So like I had to heat it up in the microwave a little bit in the glass jar, get it a little softer so I can mix in the clove. But that's what I used at my house. This morning I did oil pulling actually before I came here, and you just take a little spoonful. Usually it's like this. That's way too much though. You want a smaller, just like a teaspoon, and then I dip it in xylitol powder right here. So here's some xylitol powder. Because xylitol, you're going to see in a few slides, it disrupts the biofilm on your teeth. And so if you want to promote disrupting that biofilm so you won't have plaque and tartar and the bad bacteria, then you want to add xylitol in with your coconut oil. And then you put it in your mouth and you swish it around for, the studies say 10 to 20 minutes. I usually can only do it for 10 minutes max, and then I'm tired of holding this stuff in my mouth. So it dissolves, it mixes with saliva, and then you just swish it around through your teeth, right? And I do it while I'm taking a shower, and then don't spit it down the drain, because it's coconut oil, this is solid at room temperature, it's gonna clog up your drain, right? So spit it in the trash can, okay? And then I usually use a copper tongue scraper, and I scrape my tongue, and then I brush my teeth like normal, and then I scrape my tongue again, okay? Your tongue holds a ton of bacteria, and if you can get that bacteria off your tongue, you will help change the microbiome in a more beneficial direction, because you're getting rid of the hiding places for all of the bad bacteria. Okay, so that's oil pulling, and I say a couple drops of clove essential oil, but you can also use this Gum Guardian that you can get on Amazon, and it has a great mixture of herbs that are super great. I used to mix it myself, but now I don't. It has thyme and cinnamon and myrrh and clove and peppermint, basically, and spilanthes. All of the herbs that have been shown to be super beneficial for your mouth health. So you could buy this, it's pre-mixed, and just put a couple of drops in your coconut oil, and then use your coconut oil daily and dip it in xylitol powder. So that's great. So that's that one. Then you can rinse your mouth with hydrogen peroxide or water with that Gum Guardian in it, or with xylitol before bed. Because the xylitol is great to have in your mouth right before bed, because you want it covering your teeth to break that biofilm. And then I use an herbal toothpaste that does not have any fluoride in it. This is my favorite. I love it. It tastes delicious, and you only need a little tiny bit on your toothbrush. You can get it from Amazon too, in big 6-packs and stuff that'll last you forever. And then I love using an ultrasonic toothbrush. They have been proven in studies to work really good at helping disrupt the biofilm. This is a great one. Brush with activated charcoal 1 to 2 times a week. Remember, this is the gum regeneration protocol, and for people who really need some help. And so I usually have, and I didn't bring it with me, a little glass jar, and I dip my toothbrush in charcoal, and I do this about once a week right now for maintenance, right? And then I brush my teeth, and I have a little bit of toothpaste on the toothbrush first, so I water, put some toothpaste on it, and then I dip it in my charcoal, which makes a mess, so make sure you're right near, your sink. And then I try to get it in my mouth without breathing, because if you breathe, if you exhale while you're bringing the toothbrush up your mouth, you're gonna get black powder everywhere, so hold your breath. Okay? I know this from personal experience. And then you brush your teeth and you're gonna have black everywhere, so don't have clothes on that you care about, like make sure you have your t-shirt on or something like that. And then brush real well, and it will bind. Activated charcoal powder is extremely sticky, electrically speaking, and it really wants to bind to anything. And so it will get into those gum pockets that you have, and it'll pull out all those bad bacteria. So I usually brush with it, and then I rinse out, and then your mouth, even if you rinse and rinse and rinse, you're still gonna have black everywhere. It's just the way it is. So then I use a baking soda toothpaste, Ecodent, and I brush with this white baking, and that will get all the black out, right? And then so it's like a double brush with charcoal and with Ecodent, and then I use my tongue scraper again, and I get all the black off my tongue, because remember, any black is binding to toxins, and you want to get those out of your mouth. And so there's two things that the charcoal will do. It binds to all the toxins that are stuck deep into the pockets of your gums, but it also whitens your teeth. But it is a little abrasive, so I don't recommend using it as a daily thing, once a week maximum. Okay, so that's that. Then Ecodent, baking soda, and use a water pick is great daily to use. This is my travel one. It's fantastic. It's like goes in this little case right here. See, and you can use it also for sinus flushing, which I talked about sinus flushing before. But it has a little water tank like this, and then you pull this up, and it has in here the little attachment, so you put your little thing on it, and then this pulls off. And you fill this with water, and then you have your little portable water pick, right, that you can travel with. Works great. I love it. And like I said, I don't care about your teeth, I care about your heart. So that's why I have a whole travel kit that I have, where I bring a tiny little thing of coconut oil, tiny thing of xylitol powder. I bring all of this with me every time I travel. Okay, and then a tongue scraper. I like the copper ones because the copper will help leave a residue that helps kill the bacteria even more. So if you're gonna do tongue scraping, you might as well use copper. That's the way I feel about it. And then lastly is this probiotic dental chews, and that's this right here. These are like any other probiotic, except you chew them. So you chew them, let it mix with your saliva, and then swish it around your mouth, and then swallow it. And this is great to do before you go to bed to repopulate your floor, especially on the days that you use the charcoal to bind to the toxins. You want to immediately then re-inoculate your mouth with the good bacteria that's healthy. So that's what I recommend you do. Okay, so let's go to the next slide. Okay, so that's all for your gum health, right? Like gum and mouth and teeth health and that kind of thing. But there are other things you can do to create a complete oral health picture, right? And so we already talked about it. Diet, you're changing your diet and eating less carbohydrates is the #1 thing you can do to change your oral, but it has to be super consistent, so do what you can on that one. Follow the oral hygiene protocol that I just outlined on the previous page. Get your mercury fillings removed by a biological dentist. Get your root canal teeth extracted by a biological dentist, right? Endodontist. And don't expose yourself to fluoride in any form. And now, we haven't talked about this one, this is our last one. Make sure you use a CPAP or an oral appliance if you have sleep apnea. And you're like, well, how does that have to do with your mouth? Well, the thing is, and I'm going to talk about it here in a second, so but for now, this is a repeat, so you don't forget. This is why I put these slides here, so later you can refer to them. There are other brands besides the one I have. Any one that's for your teeth and gums is fine. They're based on studies. There's the dental pick, water pick that I use. Also, a lot of times you're traveling and you can't brush your teeth right away. Like, it's just not possible wherever you're at, right? Well, then I recommend bringing some xylitol gum with you, chewing some gum after you eat a meal. That will coat your teeth with xylitol, which helps prohibit the bacteria from creating the biofilm, right? So there's all different kinds. Almost all gum now has xylitol in it because they all are getting on the bandwagon, which is fine with me. That's great. Okay, and so then what about, people say, well, what about mouthwash? Well, if you're gonna swish your mouth with something, I do oil pulling, that's what I recommend you do. But sometimes people want it, if they're in a hurry or whatever, you can use mouthwash. Nowadays, you can get mouthwash like this one called Xylee Swish, and it has xylitol, so, but you can make that. You can I buy xylitol in big giant bags for very inexpensive from Amazon, and I use it in all kinds of things, including a nasal spray to break the biofilm in the nasal cavity, so that way airborne contagious pathogens that might be going through the air will not adhere to the membrane in my nose, and it will help me get rid of it and flush it out with a saline wash, right? So I use xylitol in my own homemade nose sprays, and it works fantastic for helping bacteria that might be in there and viruses not adhere so you can get them out. So I recommend buying a whole bag of xylitol and making things with it, making your own nose spray. But you can definitely make your own mouthwash very, very easy. You don't need to buy any, but it's up to you. So like a xylitol powder mixed with a little bit of Gum Guardian and some water would be a fantastic mouthwash. That would be a really, really some of these are expensive, but you'll see that the ingredients in this one is almost the same as this, right? Okay, they just dilute it for you and then charge a lot, right? So you can do what you feel like doing, it's up to you. All right, so, okay, hold on. So now we're talking about xylitol and erythritol, but I told you xylitol breaks the biofilm. Here's a study that talks about it. So if you want to read it, you're welcome to. It basically says it induced inhibition of biofilm formation, and it suggests the inhibition to proliferate, blah, blah, blah. So basically, you can affect the biofilm positively in your teeth by having xylitol. I don't recommend eating it. It's very sweet. It's like, oh, I could use this as a sugar replacement and put it in my coffee. Xylitol, over time, taken in quantities chronically, will cause digestive distress. So eating a piece of chewing gum is fine, but don't use it as a sugar substitute in your baking and in your coffee and that kind of thing. I would rather use it as a mouthwash where you swish it around and then you spit it out, right? So that way you don't cause GI issues in your future. Okay, so biofilms, we talked about it a little bit. There's a lot of articles up if you want to dive down that rabbit hole and find out about biofilms and how they're created on the tooth. But here, they start usually in the pocket that's where the gum recedes from the tooth. That's where the biofilms start. Here's some more pictures of the biofilm and some complicated words here on how it starts causing problems, right? And here's where they talk about the dysbiosis is a trigger for oral disease. So basically this biofilm is the beginning of all your problems. So if you can stop that biofilm from forming by inhibiting it, or the bad biofilm, then you've really helped with all of the different oral problems. And then here's a schematic showing all kinds of different problems that can happen from the pathogens in our mouth. Alzheimer's, rheumatoid arthritis, and here's the study. You can read about it right here, how the oral bacteria is correlated with all of these issues. So it's good for not just your cardiovascular health. Okay, and I'm going to talk about this because I told you that the number one thing that I recommend is plant-based vitamin C. So scurvy is vitamin C deficiency, and it's characterized, its initial symptom is swollen, bleeding gums. Don't you find that interesting? Right? So now, I'm not saying if you have bleeding gums, you have scurvy. That's not what I'm saying. Well, what I am saying is there's an association between local scurvy, that means your gums needing vitamin C, and them bleeding, right? Now, the rest of your body may have plenty of vitamin C, but if your gums are bleeding, that's a sign that there's local tissue vitamin C deficiency, right? So you need to help them by giving them vitamin C. So I recommend taking vitamin C. Now, so I'm not the only one who thinks this. If you want to listen to this doctor right here, Dr. Berg, he talks about subclinical scurvy and it's basically about capillary damage and vascular integrity. So if your gums are bleeding, that's because they're inflamed, because there's probably a poison in there. That's probably that biofilm, making things upset. But it will slowly spread to all of your arteries, including your heart, your coronary arteries, which is why you have to solve it in your mouth first, right? But the vitamin C is not going to just help your gums, it's going to help all your vasculature in your brain, arteries in your brain, arteries in your heart, arteries everywhere will be happier with the vitamin C. And so this guy talks about it for about 4 minutes. It's worthwhile listening to this one. The heart, he really starts talking about how this subclinical scurvy or this vitamin C deficiency affects the heart. He talks around about minute 2. So that's a great minute to fast forward to. Here's some 100, well, this one's the only exception right here, and we'll talk about this in a second, but this one is 100% vitamin C plant-based. This is 90% or 95% plant-based. This one's 100%, this one's 100% plant-based. This one's pretty inexpensive. This is like an Amazon Elements brand, you know, which is probably the best price I found so far for one that's over 90% plant-based. But this is the one I typically use, as you can see right here. And the reason I have this sunflower lecithin up here is if you read that, what this is phosphatidylcholine, and that's going to be important here in a second, but it helps you absorb vitamin C a lot. It's very good for your brain. So, and liposomal is another, this one right here is that one up in the top left. It comes in little packets like this, and you squeeze it into your water, and it's gooey sort of, it's weird, and it's because the vitamin C is encapsulated in phosphatidylcholine, okay? And these are like over $1 each or something, but this is pretty inexpensive for 100 of them, and so you can't liposomally encapsulate it, but just taking them at the same time, your vitamin C and your phosphatidylcholine or your sunflower lecithin, is much more effective. You will get much bigger bang for your buck with the vitamin C when you do that. Okay, so benefits of tongue cleaning. I wanted to bring this up because I've mentioned it a few times, my copper tongue cleaner. It definitely is one of the best things if you have bad breath. It will cure your bad breath, and because it removes the bacteria that causes halitosis from your tongue, and it makes you taste things better. Supposedly, I have to look up the studies to confirm that. But it has been proven to help immunity. This is the one I care about. It slows plaque formation on the teeth, right? Okay, that's what I want, right? Okay. All right, so there's how you use it right there. Stick it as far back as you can without stimulating your gag reflex, and then just scrape your tongue. Do it over the sink because you'll see a film, and then I just rinse it off, and then I throw it in my drawer. It's very easy to use, takes a second. All right, oil pulling. Here's a whole book on oil pulling and the benefits of it and how to do it. Here's a little quick, if you don't know how to do it, that's how to do it. I've already described to you how I do it. I dip it in xylitol powder. If you're gonna oil pull, please just use the xylitol powder too. You're gonna get a double bang for your buck on that one too. Okay, benefits of oil pulling, here it all is. I think I've mentioned a lot of these. It's an Ayurvedic practice. This is a kit you can get on Amazon that has the oil pulling liquid as well as the tongue scraper, you know. Although remember, you don't need to buy an oil pulling liquid. You can just use coconut oil dipped in xylitol. If you want to have some beneficial herbs, you can use Gum Guardian. It has like 8 or 9 herbs in it. The same stuff that's in all of this. And like this one, while that's a pretty tongue scraper, I really recommend copper. This is an interesting one because it's ozonated. So if you want to go all out, like you have a bad mouth and you need to fix it, you might want to use this one at first, because this one they actually take the oil and they ozonate it. And so it actually smells like ozone, the liquid does. And ozonated oils have been proven to help fix and heal gum disease. So this little thing is a little, I can't read it, by the same company. It's called Pure O3 Tooth and Gum Support. It's like a little, so it's by the same brand. It looks like a little Vaseline or something, you know, it sort of looks like Vaseline. You can come take a look at it. You can come up here and smell it. It smells odd. It smells like ozone. And you can massage it into your gums where you might have an abscess or some inflamed gums, and it tastes horrible, even though they put peppermint in it, but it will kill that bacteria. And we're almost done here. I think we're done. So yeah, this is what's the ingredients are in this oil pulling compound. If you get it, there's the tooth and gum support. This I'm bringing up because this gentleman here wrote this book right here. Weston A. Price wrote Nutrition Physical Generation, and I bring it up because most of us, our facial structure has changed because we have been raised on the Western diet, and our mothers were raised on the Western diet, and it changed our facial structure to make it more narrow. It made our bite pattern more narrow and our eyes closer together, and it changed our jaw. So that affects your sleep. So here's some pictures from the book. The book's actually fascinating, but these are people from the same indigenous tribe, and this guy went all over the world, and that's when they're eating their indigenous normal diet, and this is after one generation of eating the Western diet. And then here's a child born to a mother who transitioned to eating the Western diet. And what you're gonna see here is his teeth don't fit in his jaw, right? His jaw's narrower. And he has a retracted mandible. See how the mandible goes back instead of jutting out, okay? And his face is narrower than you might see otherwise, right? And here's some other examples. So this whole book has just nothing but pictures of every indigenous culture everywhere. He went all over the world, this guy, Weston A. Price, trying to figure out what creates health in a human, right? And it's ADK, basically, and the critical one was vitamin K2, that was it. The one I talked about, taking the hand of the calcium, right? And but most of us, like even me, like I had to have orthodontia treatment when I was younger because my teeth did not fit in my jaw. I had 8 teeth removed and then 4 more from my wisdom teeth, right? So I've had 12 teeth removed. I have no canine teeth. And it's because if I bite a piece of bread, you'd see it. I have a tiny little bite pattern, right? It's narrow. And it's typical for a lot of us now. You see it a lot with British people. You'll see their faces look narrower. All that is nutrition deficiencies. That's what that is. Usually of the mothers when their child's in the womb. But we can help this by eating, we can help ourselves by eating the right vitamins, A, D, and K. That's what you want. But in the meantime, you know, my jaw is what it is. Now, they fixed it with me. They helped. I had a really big overbite, just sort of like this guy back here, but maybe not quite so pronounced. Hold on, let me show you again. Like this, I had a big overbite, right? And my overbite was not because my teeth were going like this, it was because my entire top jaw was out, right? So I couldn't close my mouth easily to sleep, my sister and I, my twin, and so they held our top jaw in place and let our bottom jaw grow out to it, right, to change it. Otherwise, if I was an adult, they would have had to break my jaw to move it into the right position. Luckily, they didn't, but it was equally painful, I'll tell you what. I hated orthodontia. And, but I'm glad I had it done, because now I can close my mouth when I sleep, and I'm not walking around with my mouth open all the time. And so that was one of the best things my parents did for me, along with many other things. But the deal, though, is, you know, this is nowadays, like, here's a person who has the retracted mandible. They'll do surgery and actually correct where your mandible is placed. And now, not all of us can do that, but the reality is, who cares, and what does this have to do with heart health? Well, what it has to do with heart health is if your jaw, your top and bottom jaw aren't in the right relationship, especially if the mandible is retracted, then it closes this airway when you sleep, and it causes sleep apnea. And sleep apnea is directly associated with heart disease and heart attacks, right? So if your jaw is not where it should be, especially when you're sleeping, you need to use an oral appliance to try to hold the bottom jaw where it should so it doesn't clog this airway. Because lack of oxygen while you sleep we sleep for many, many hours of our lives, and it causes systemic inflammation in our whole body and leads to cardiovascular events. So nowadays they're making them really slim. The old ones were big and clunky and just a pain in the butt. But nowadays, I mean, they're pretty slim now. You can get them custom made, and it's sort of like having a tooth grinding guard, right? But they call these ones oral appliances, and they're basically an alternative to using a CPAP. But if you have a CPAP and you use it, please keep using it, because that's going to help you breathe and not have cardiovascular events. But here's some of the statistics on how obstructive sleep apnea is related to all these problems, right, that have to do with your heart. So please make sure you don't have sleep apnea. It's extremely important to your health. And lastly, yep, sleep apnea affects your whole body. I have a whole lecture on my YouTube channel on sleep. It's an hour and a half. And so that's it, that's my last slide. And so if sleep is one of your issues, please go to my YouTube channel and watch my lecture on sleep, because it's very informative. And that's it, so please, any questions?